his emotional journey from 0 to 25 years. Let's see what Chino has to say today. So Chino wants to talk today about the independence. He says, I see your hands come fast to help. Before I even try, you think I need you every time. But please, just let me try. It's people who have joined today, people who were not there in last two sessions. I want to tell you that this is Chinu's story. Chinu is an adult with autism, and he has been writing about his struggles, emotional struggles, and today about the dependency he is writing. So he says, but please just let me try. Relate it with your own children, dear parents. They feel, they understand that you are faster to help. They understand and they feel that you are there to help. Every time you go there to help them, but they want to try. So Chino says, my fingers shake, I take more time. My way may look so slow, but every step I do alone helps me, my confidence grow. When I spill or make mistakes, don't rush to make it right, because inside I'm learning how to stand up to fight. Or show it like you do. But deep inside, I'm whispering, I want to try it. One day I'll tie my own laces. One day I'll find my way. Not because it came easy, but you believed I could one day. So it's parents' trust. Parents believe that child can do it one day. And the opportunities they give him to try, even though the child is doing it slow, even though the child is doing it with mistakes. So walk with me, not ahead of me. Don't walk ahead of me and pull me. Usually, we as parents do this mistake. We want our children to walk as per our pace. So we walk ahead and pull them, drag them. But Chinu says, walk with me, not ahead of me. Let me fall, yet stand tall. Because independence for someone like me is the biggest victory of all. So with this, with the expression of Chinu talking about independence, let's understand why independence matters, why it matters in case of autism. So many parents focus on speech, academics, or behavior, but independence is what defines long-term success. A child who can eat, dress, and manage daily life will have better self-esteem and reduce frustration. Also, independence reduces long-term caregiving stress. So independence of our children helps us at multiple levels. Our major focus is usually on speech or academics or behavior or the matter of concerns. But the independency training, ADS, life skill training shall start right from early childhood. We usually see that happening only in adolescent, only in teenage or adulthood. But that should start as early as possible. Because it's not only for the child, but it also is for the caregivers, for the parents, for the family. It reduces their burden, it reduces their stress. So it builds self-esteem, it improves the quality of life of the individual or individual with autism and the caregivers, reduces caregiver burden, and enables social inclusion as well. So what are these daily living skills that we need to? Usually we talk daily living skills as toileting, taking bath, wearing clothes, but they are much more bigger. We can divide them as basics, instrumental, and executive. Basics are eating, dressing, hygiene, taking on shower, brushing your own teeth, making your own plate, serving your own food. Instrumentals are cooking, money counting, calculations. Those are instrumental, handling money. And the executive skills are planning, decisions. They all are important life living skills. They all help us to go towards independence. So taking my own decisions, planning my own things. So we are preparing the child for life, not just for school. So these all things should start. Even the instrumentals, even the executive skills should start at very early age. But it is never too late. Even if you have not started as a parent, so do not worry, it is never too late. The core problem is the harsh reality which I want to talk. Children grow in age automatically. With the calendar, they are growing in age. But independence does not grow. If we don't actively teach it, the gap increases over time. So we need to teach independence actively. We need to have the ADLs training for our children. We can also train them as parents. And wherever you need support, you can take guidance support from the professionals. But what are the common challenges? As a parent, if I want to train on ADLs to my own child, what are the challenges which I face and how do I overcome those? So children with autism are not unwilling. Usually we get messages from parents when they talk in general talks and all, they say, my child is not willing to learn. My child is not willing to do it. Then I have to do. They are not unwilling. They are always willing to do new things, but they are unable due to their sensory discomfort. Let us understand their challenges. They are unable due to difficulty remembering steps or communication gaps or the rigidity. So understanding this part that they are not unwilling, but they are unable, changes our approach from frustration to support. I have been telling my child to get up and go for brush, go to the washroom and brush your teeth 10 times, but child is not going. Child is not willing to go. Child does not want to do own brushing. That gives me frustration. But the moment I change my thought process, why my child is not willing to do brushing? Why my child is unable to do it? What are the core reasons behind it? When I look into the sensory concerns like sensory discomfort due to brushing, due to brush giving pain on the teeth, or difficulty remembering the steps in brushing my teeth. Once I understand this, my frustration is gone because I understand my child. Understanding your own child is the first step of success. We as parents often misunderstand the children with autism. Often we do that. So we need to look from the perspective of what are the challenges my child is facing? Why my child is unable to do this? Instead of my child is stubborn, my child does not want to do it. He knows everything, but he doesn't want to do it. These are the common concerns parents when they come to me, they speak these lines. See, knowing a task and doing it are two different activities. These are two different things. I know how to read, but do I want to read this novel? Do I enjoy reading this novel? These are two different things, right? So child knows how to do it, but does child enjoy doing that? Or there are struggles child is facing due to his own challenges of sensory discomfort or remembering step or other challenges that we need to look into. So change your perspective from today. Instead of child is not willing to do it, child is unwilling to do it, child knows it and doesn't want to do it, child is lazy. Instead of labeling the child like this, try to find out where the gap is. Immediately, the moment you change your own mindset, you will see improvement in your children. You don't have to do much. Just change your perspective. And you yourself will see improvement in your children. I assure you, next week you will come back to me and you will say, sir, I have done this and I'm seeing improvement. The golden principle, many times out of love or urgency, we do things for the child. But every time we do that, we reduce the opportunity to love. We are in hurry. We want child to do it fast. Or we love our child. So out of emotion, out of love, out of affection, we do things for the child. But dear parents, with due respect, please remember, This love, this affection is creating a hurdle for the child to learn. So you are not doing benefit to the child, you are doing harm to him or her. So never do for a child what they can learn to do themselves. Involve them into it, irrespective of their age. Even if the child is 2 months, 2 years, or 3 years, or 6 years, or as a child is an adult, at least involve. Start from involvement. So never do a thing, an activity for a child. Like, for an example, packing on tiffin. You can take help of the child. Putting books in the bag, you can take, or toys in the bag, you can take help of your child. Let the child do it. Majorly, we see that we want children to do it perfectly. We want children to do it on the speed as we do it. And that's where the challenge is. Child has not learned the skill and you are expecting perfection. Child has not learned or practiced the skill and you are expecting time management within the time frame, limitation of the time you need to do it. And that's where our children struggle. And you start doing it because they take more time, they do it imperfectly, we don't allow them to. Just because my child, while eating food, he spills around, he creates more mess, which I need to clean later, which is time consuming and tiring for me. I start spoon feeding my child. Agreed. For a short term, it might be beneficial for you because your work becomes less and it is easy. But remember what harm you are doing to the child. You are reducing the opportunity to learn. The child is not able to learn how to eat on his own for rest of the life. So never do for a child what they can learn to do themselves. So when you are working for your child, make a list of all the tasks tonight. Sit back. It should be an eye-opener session for you. Make a list of all the tasks that you do for your child in the entire day. And find out the opportunities where you can involve the child into it. I would say start with that. Later, let's see, we'll do the task analysis and learn more. So ideally, these are some categorizations which I've given, not necessarily you need to go with them. You need to go as per your child's abilities. Always go as per your child's strength and abilities. But these are the ideal recommendations. Like for children 0 to 3 years, we call it as foundation of participation. So this is the foundation age. Don't aim for perfection, aim for exposure. So exposure and early participation is the goal at this stage. So even if the child spills food while eating, let them try. Learning begins with experience. So at this stage, feeding self, toilet readiness, simple routines, all these things that we need to look at. Then comes the age 3 to 6 years, early independence age. Here, our goal is to start doing simple tasks with help. Don't expect your child to be independent. Don't expect your child to be perfect. But simple tasks, they can do it with help. So eating with spoon independently, removing simple clothing, toilet training, following 1 or 2 step instructions. You can provide help to them via visual routines, picture cards, repetition and consistency, and immediate reinforcement. The moment they do it, reinforce it. Reinforcing means you give them some sort of appreciation, award, in terms of, it could be a tangible item, it could be chocolate, chips, biscuit, or toy, whatever child likes, or appreciation, a clap. Even a clap works as a very good reinforcement. Appreciation, verbal appreciation. A slight tap on the back. Wow, very good. You did a good job. All these are reinforcement for a child. Then comes the age 6 to 12 years. This is the skill building stage. So now we build responsibility. The goal is to build daily routine independence. Child should be independent in own daily routines. So children should start participating in their daily routine, packing bags, dressing, helping at home in cleaning the room, in making the bed, in folding the bed sheets, everything and anything that they can do. Just involve them. Even if they are doing it imperfectly, I'm repeating it again, even if they are making mistakes, even if they are taking more time, you feel that you can do it faster, you should involve them. Even in cooking, basics cooking, start with basic sandwich making or cold kitchen. Cold kitchen is like making salads where you don't use microwaves and the hot plates or the burners. Such kind of activities you can start with and then slowly increase. So this is where the habits are formed. So daily routine habits can be formed from 6 to 12 years. So dressing independently, school routines, basic course of household activities can be introduced at this stage. 13 to 18 years, the most crucial age for a child with autism, even for a parent with autism. Our focus is usually on early childhood, early development, early intervention. I agree with it. But we forget that these children outgrow. Yes, they may mask their symptoms of autism, they may cover up with the symptoms, but autism is a lifelong condition and they would require support. They would require support and guidance, especially during transitions from childhood, early childhood to childhood, preschooling to schooling, childhood to adolescent, adolescent to adulthood. They require at the time of transitions because there are changes in body, hormonal changes at this age, 13 to 18 years. There are a lot of changes happening in body on hormonal basis. So they require support to understand the emotions, understand the feelings, arousals that we need to work on. So this is the age when we want to teach them responsibility and awareness. They need to be more responsible now, and we need to make them aware about various things. So this stage is very critical. We must focus on hygiene, boundaries, and social awareness. Independence here directly affects dignity and social acceptance. So personal responsibility, the goal is the personal responsibility. Child should be able to take own responsibilities and social independence as well. Personal hygiene, time awareness, social boundaries, and travel training, short distances travel training as per the safe environment. That should also begin at this stage. And then finally, 18 plus years, adulthood, functional independence. So at this stage, the goal is life readiness. Child should be ready to face the society, ready to face the life. So the goal is functional independence, not perfection. Again, so any stage you see, we are not taking perfection as a goal. Perfection comes with experience. Perfection comes with repetition, consistency, generalization. It automatically comes. So even partial independence, like doing simple chores or handling small money matters, is also a big achievement. So vocational trainings, money management, household tasks should be part of a child's activities or adults' activities, learnings. Now, how do I teach? How do I do all of this? I want my child to start brushing, but my child does not even want to come with me to do brushing. He does not like it. How do I do that? First thing is we need to understand how does autism brain function. Once we understand this, half of the battle we win. The major challenge which I see with the parents who come to me, they have very little awareness about what autism is. Child is with the condition of autism, which I just call as a difference. I don't say autism is a disease or a disorder. It is neither a disease nor a disorder. It's just a difference. Cognition difference. Difference in the way we perceive the things, we take the information through our sensory input. Difference in a way we process the information, and difference the way we express them. It's just the difference. So once you understand how does an autism brain function, things become very easy for you. Autism brain always learns step by step, not as a whole. So instead of saying brush your teeth, you break it down into small steps. Give one step at a time. This reduces confusion and increases success. So that is called task analysis. Any task we want to teach them, any skill we want to teach them. Every skill has multiple events. Like if you want your child to be independent, go and drink water from the kitchen whenever he is thirsty, not to be dependent on you. You need to do the task analysis. The child has to go to the kitchen, open the drawer, take the tumbler out. I'm just giving you a visualization. Your home settings may be a little different than this. Open the fridge, take the bottle out, open the bottle, pour water in the glass, close the bottle, keep the bottle back in the fridge, then pick up the glass, drink water, and put the glass back in the sink to wash. Man, how many tasks are involved? How many skills are required for that? Your fine motors, gross motors, a lot of things are required. But if you teach one task at a time and start practicing that. So you want water? Let's go and drink water. Even mama is thirsty. Come along with me. Take the child to the kitchen. Physically show to the child. Open the drawer. And then catch hold of child's hand and open the drawer. Don't be in hurry. Not in first day. First day, just physically show. That's called modeling. Just show it. Second day, catch hold of the hand of the child and open the drawer. Take the glass out. Third day, teach him how to open the fridge and close the fridge. What is the pressure he needs to put? How much pressure he needs to put to close the fridge? He should not be banging the fridge or opening it with too much of pressure. Fourth day, teach him how to open the bottle and close the bottle. Fifth day, teach him how to pour water. It's okay if he spills water. It's okay if he's not fill up the whole full glass. It's okay. We should appreciate the attempts of doing it, not the perfection. Even if child is attempting to do a task, even if child is doing it wrongly. The major problem with us as parents is that when child is attempting a task, we immediately get into correction. Child is trying to do it. You have taught it. But we immediately start correcting the child. And that's where the rigidity comes. Imagine with yourself, if you join a new office, you go there on the first day, second day, third day, very initial days. Whatever you do, your boss finds mistake in it. No matter how much efforts you put, no matter how much efforts you are putting in learning. Whole night you are awake till night 2 o'clock, 3 o'clock, you are awake, you make a presentation, a beautiful project, you take it back in the morning with a lot of excitement to the boss. And the boss immediately takes it and ticks and says, cross, cross, cross. Oh, these are the mistakes. No, change it. How would you feel? Or at home, you have learned, you are a mother, you have learned some new dish from some internet or some recipe book. And that dish is like, for an example, it is favorite of your husband. Your husband is about to come from office. You have spent the whole day preparing that dish. You serve the dish to him and he tastes it and says, oh, this is not that good. You should have done this. You did this mistake. How would you feel? This is how our children feel. Exactly, this is how our children feel when you get into corrections before practice. When you do, even they're just attempting it for the first time, second time, and you immediately get into corrections. Most of us do this mistake. Recall your own child, recall the way you teach your child, recall when the child started writing, when the child started holding the pen. For the first time when child holding the pen, you immediately went into correction. Don't hold it like this, hold it like this. You immediately started this. And that puts them under stress. That takes away their confidence. Perfection can always come later. Corrections can always come later. First thing is, they should be motivated to do it. They should be encouraged to do it, even if wrongly. So do the task analysis, break every task into smaller steps, teach one step at a time, and practice it. provide visual supports. So show it to them, physically do it and show it to them, or show it to them in pictures. You can create one task, second task, third task like pictures, step by step. So they see first task, okay, I need to go in the kitchen and open the drawer. Second task, take the glass out. Third task, open the fridge, take the bottle out. Likewise, you can show them because many children in autism are visual learners. They love to learn from visual memory. So if you say something verbally, it may not stay with them for longer. But if you show them, it stays long. So visually, you show them practically by modeling, by doing it, or by charts or by pictures. They understand better. Then comes prompting and fading. So first, I show it to the child. Then I hold the hand and do it. And then I let the child do independently, but I give verbal commands. And slowly, I stop giving verbal commands also. Now, this is where we make one more mistake. One more big mistake we make here. What is that? We often help too much and continue to help forever. The goal is to help, reduce help, independence. Our goal is to, strategy is to show physical, then go to verbal, and then go for independence. But we show physical, we go verbal, and we remain on verbal forever. So prompt fading, that is very important. So if prompts are not faded, dependence increases. It does not decrease. If you keep on giving commands, if you keep on giving guidance, it increases. Let them do it once. Yes, they might miss some steps. Give them visual charts. Let them see the chart and follow and do the steps. It's okay if they miss some steps. You can intervene later. But then and there you are standing and you are asking them to do it and then giving prompts on everything. They are more dependent on you. You feel child is doing on his own, but child is dependent on your commands. So this is very important point which we need to remember, that prompting needs to be faded. Consistency is the key. If mother teaches one way, therapists are teaching in another way, and the school is teaching in third way. These are the three major environments for our children: school, therapy centers, and home. Child gets confused. So consistency. All three of you should be aligned. Connect with the therapist, connect with the teacher, and then see what they are teaching, how they are teaching, similar things you do at home. Or what you are doing at home, tell them, let them do the similar things. Similar things means the style of teaching. Doesn't mean the same task. Same task, same way. So same steps, same expectations. Consistency is not optional. It is therapy. So that is very important. Reinforcement. As I said, reinforcement is a small token that is given to the child to motivate, to appreciate. And that token can not necessarily, it always has to be candies or chocolates or ice cream or chips. It can be verbal praise, it can be tapping on the back, it can be appreciating, it can also be clapping. So children repeat what is rewarded. Even small efforts should be appreciated. Don't wait for perfection, reward progress. So we wait, we say you complete this task and then I'll give you this reward, not the complete task. Start appreciating the efforts. Even if child is taking the efforts to do a task, you should appreciate that. Even if child is doing a task with imperfection, you should appreciate that. Even within the task, child does one step, you should appreciate. The confidence level will go up and child will jump to the next task. Then only child will be motivated to do the next task. Many a times parents make mistake. Often do things faster themselves. We are getting late for the school. He is taking time, so I just give him shower. He takes time to wear clothes, so I just put the clothes to him. Adjust your schedule as per child's speed. Wake up early, or let the shower happen in the evening, or something you need to do with the schedule. Extra works that you do in the morning, assign it to your husband, assign it to your wife, assign it to someone else. But be involved with the child. Just because you can do it faster than the child, and you are doing it, that means you are making your child dependent on you forever. I don't want to scare you. I don't want to just make you feel burdened. But remember, we need to prepare our children for the day when we are not around. No matter how much we love them, they need to be independent. Life is uncertain. So, children must be prepared on independence. Another mistake we do, we give up when child resists. When child resists for a task, for any work, we don't have to see their resistance. And we don't have to force them also. We immediately need to get into analysis, the task analysis. What task I'm asking the child to do and where could be the struggle? Struggle is never in the whole task. For an example, brushing the teeth. Again, I'm taking the same example so that you can connect back with it. Struggle is not in the brushing the teeth. Struggle could be with the bristles of the brush. Struggle could be with the texture of the paste or the flavor of the taste of the paste. Struggle could be with the water, gargling, or struggle could also be with opening the tap and closing the tap. Because these all steps are there in the task. So struggle is never with the whole task. Struggle is always within the task in few steps. So to start with, do the task analysis. What are steps child can do easily? Child is happy doing it. Start with them and assist the child in the task where the struggle is. And then provide support. Change the environment, change the tap or paste also you can change. You can go on powders. You can try different strategies. You need to do your own analysis, try strategies. But don't give up. And don't be forceful. Forcing a child will also bring more resistance in autism. So don't be forceful. When child is trying to resist, give a short break, do the task analysis, understand where the struggle is, and then continue. Focus only on academics. Yes, parents do this major mistake. Our major focus is only on academics and making child ready for the school. We have to make child ready for the life, not just for the school, not just for academics. Independence is more important than marks. It's okay if my child is not getting good scores in school, in academics. But if he's learning the life skills, those are more important. So doing everything, stopping on resistance and focusing only on academics are the major mistakes that parents do. So here I have a 5-step model for you all, dear parents. The 5-step model is assess what child can do and then break tasks. Break into smaller task analysis. We have just seen. So smaller steps. Teach step by step. I've given you example of teaching how to go to the kitchen and drink water. So teach step by step. Reinforce in terms of some appreciation, award, verbal or physical. Then journalize. Whatever child has learned, journalize that. Practice that in different environments. Now child has learned opening the drawer and closing the drawer in the kitchen. You may have drawers in your table also. So involve child in some
मेरी
activity
दवाई
where
खत्म
child
हो
is
गई, मेरे को
opening and
दवाई ला
closing.
दो, कल की डोज नहीं है.
I would just request you to mute. Yeah. So generalize the task into that. Yeah. Purposely keep some toys in a drawer. So there is a motivation for the child to open the drawer, see the toys, take them out, close the drawer. Likewise, in different environments, whatever task you are doing, let the child practice that. Same task, same steps. Not the same sequence, not the all series, but step by step. Each one task, each one step separately in the environment. And follow this consistently and you will see the change. If you seriously follow these, I'm sure you all will come back to me on next Sunday within 7 days and you will say, I'm seeing improvement in my child. You will see, you will come back and say that this is helping me. So we need to follow this 5-step model. Generalization, I've already explained to you just now. A child may learn therapy, but not apply it at home. That means learning is incomplete. So skills must be practiced in real life environment. Whatever child is learning in the therapy session, in the classroom, or at home should be practiced in different environments. So imagine how a child feels. I want to relate you back with Chino. Chino says, I want to do it, but I don't know how to do it. This is not stubbornness. It is helplessness. We say child is stubborn. He doesn't want to do it. He is unwilling to do it. But child is not stubborn. Children with autism are never stubborn. I don't find them stubborn ever. I always find helplessness in them. They want to do everything. Given an environment, given the support, they want to do everything. They just don't know how to do it. Their own struggles, communication barriers, sensory issues, own struggles come in between. So if we work on those barriers, they are very happy to get involved in everything. And this is, I am speaking from my experience with Spandan children. Spandan is a residential rehabilitation center for the severe autism cases in outskirts of Mumbai and district Palghar. And we are seeing all the adults. We are seeing 16 years and above children with us, 16 to 20, 32 we have. They all, when they were given admission here, parents have said that we cannot keep them home. It's difficult to manage them at home. They don't want to do anything. They are stubborn. They have behaviors. They hate. They are into hitting and all those things were there. But today I see them. None of them is stubborn. They are doing all daily life skills, all their own routines on their own. How did we achieve this? Only by following these principles that we have learned. 5-step formula, generalization, consistency, by understanding their struggle, and by doing the task analysis. But we need to start from assess what they can do. I am taking you back on the screen. Assess what child can do. Problem is we usually start from what they cannot do. That's where the problem is. We want to teach them what they do not know. But I want to start from what they know. The confidence, the connection with you. So first assess what child can do. Strength-based approach. Then take a task which you want to teach. Break that task into simple steps. Teach one step at a time. So we need to start with what they can do. Then the learning automatically happens. Reinforcement, generalization, and consistency is the key. So the action plan should be, don't try to change everything at once. Start with one skill, maybe eating, dressing, or whatever simplest skill. Be consistent for 7 days. Follow these 5-step formula. You will see the progress. You need to be consistent and do not try to do it on your own just because you can do it better, just because you can do it with perfection, or just because you can do it faster. Let the child take on time, but let the child do it. We don't want to limit the opportunities from the child to learn. So the takeaway from today's session is independence is not built in one day. It is built daily. It's not a process that, okay, 15 days of therapy and independence is built. No, it is a lifetime process. Daily basis. Through small, repeated efforts. It continues forever. So every time you allow your child to try, even if they struggle, you are not just teaching a skill, you are building their future. You are giving them independence, you are building their future. That's all for today. I believe I was able to convey the message. I'm open for the questions if any. If there are any questions, you can unmute and speak. You can ask me. People who are on Zoom, they can directly unmute and speak to me. And people who are on YouTube Live, you can just WhatsApp, you can just message your questions there on YouTube. You can just message there and I will reply. So the organization which I'm working with, I'm heading it as is called JKP Care Foundation. JKP Care Foundation is conducting these webinars for us every Thursday and every Sunday. We have these webinars at 8 p.m. India time. These are free for all parents. Any parent can join them. We also have a WhatsApp group for webinar. So there we give informations about upcoming topics and webinar timings. On Thursdays, we usually have only YouTube Live, and Sundays we have YouTube Live and Zoom sessions as well. So people who are new here, they can request us from where you got the links, same number you can reply to, or email you can reply to, and you can request us for the link for the WhatsApp group of webinar where you can be added free of cost, and we can take it. I mean, you'll be informed about the future webinars there. I have a question here meanwhile. Let me just read that for you. How do we identify delays in daily livings early? Identifying delays in daily livings early is very simple. You can Google out also. Just go with the age milestone chart, activities, functional milestones of age, and just check with your child. A 2-year child should be able to do this, 3-year child should be able to do this, 4-year child should be able to do this. It is easily available, the functional chart of age milestone. If you don't get it, please connect back with me. My number is available on jkp.ngo. You can see the website www.jkp.ngo, or I have another website that is www.dralokarora.com. So you can see me, you can connect with me. I'll send you the age milestone chart. That is not the developmental milestone. I'm talking about the functional milestone. So along with that, accordingly, you can adjust. But do not go with age. Just go with what your child is able to do and take a step ahead. I have seen a 7-year-old child making tea in the kitchen with autism. So there are children in autism who learn before their age also. So don't limit their learning with the milestone standard charts. Functional skills, step by step. If child can do this, let's go to the second step, irrespective of the age. If child, provided, we need to look into the safety. Safety is the prime concern. So there are some tasks which involves knife or the hot plates or the other kitchen utensils that we need to little bit be careful. Otherwise, go ahead. If child is able to do things, go to the next level. Start with folding a handkerchief. Go to the folding of bed sheets. Difficulty level, increase a little bit. Start with handkerchief, then the bed sheet, then the shirts, t-shirts, shorts, jeans, all of this, all the clothing. Let them fold. Let them put it in the washing machine. Let them turn on the washing machine or turn off the washing machine. A 6-7 years old child can do all of this. They can take out the clothes from the washing machine after they have been washed. They can help you in drying them, but adjust the difficulty levels as per their age. Now, if you expect a child should take out the clothes from the washing machine, which is top load, and child cannot even see that, just has to put hand, not acceptable. So if it is a front load washing machine, then they can do. Okay. Again, about drying the clothes. So have the clothes drying this stand, and they can dry it on the stand as per their height, as per their hand level. But you expect them that drying stand is at our height or the wires you have put in and that they are on height of an adult, and you are expecting a 6-year-old child to climb on the chair and then do it. That is wrong. That is injustice to your child. So whatever you want to teach them as per their height, as per their growth, as per their development, and as per what they are learning, what they are interested in. Not necessary every child needs to learn everything in a sequential way. It's okay if my child is not yet trained on toilet, but he is trained on cooking. It's okay. At least some area he is getting independent. I'm not saying don't try for toilet training, keep trying for toilet training, but interest is in cooking, he is doing that, let him do that also. So there is no sequential way of learning. Step by step is there, but there is no that one thing, this thing comes after this. No. And we also need to give them exposure. As much exposure you give them, they will learn. Let them try it. Sometimes as parents, we are full of love and we are worried about their health. We are worried about their safety. Yes, we need to be worried. We are responsible for their safety. So those parameters we need to look into. But however, some small difficulties we need to give them so that they learn. Next question, let me see. Quicker store. Okay, how long does it typically take to see progress? 7 days. I'm confident on that. Be it the child with any level of severity, mild, moderate, whatever you call it. I don't believe in that. I don't believe in levels of autism. So I personally don't look into it. But however, there are parents, they say, no, my child is with severe autism. He cannot do this. He cannot. By saying this, you are limiting your own abilities. Or there are parents who come up and say, oh, my child has just 50 IQ. What the poor child can do. I have seen a child with 50 IQ doing all daily livings on his own. I have that child with me at Spandan. Come to Mumbai, I'll show that child to you. IQ is just 50. He's diagnosed as autism and MR. But he's doing his daily livings. So IQ and autism have no correlation. And autism does not have boundaries to learn. You can teach anything and everything to the children with autism, adults with autism. So, 7 days, yes. If anybody is doubtful about it, connect with me separately tomorrow. I'll create a plan. I'll support you. I'll give you individual guidance. Yes, the sessions will be chargeable, but very nominal charge. I'll keep it. I'll give you 1 week plan only. And within 1 week, you will see the progress. That is assurance. You need to follow my 5-step formula, which I've told you. I'll plan it for your child. I'll first need to understand child's likings, dislikings, strengths, challenges, and the task which you want to teach him, where to start. And then I'll plan step-by-step procedure, give you the corrections we need to do in the environment, corrections we need to do in your approach. 1 week you follow it and you will see the improvement, definitely. But it is not 1 week job. Learning continues forever. We still learn, you still learn. So children, let them also learn. Okay, so if somebody wants to connect with me personally, you can connect with me via my WhatsApp number, via email, or via connecting with JKP team. The coordinators, they will connect, they'll book an appointment for me, and we'll take it ahead from there. पूजा says next question, अगर child काम में help मांगे और खुद ना करे तो क्या करे? Okay, the question is in Hindi, that's why I'm replying in Hindi, but I'll translate it in English also. I'm seeing there are a lot of participants from international participants also who do not understand Hindi language. So first I am reading the question in Hindi and replying in Hindi. Then I'll read the same question in English and reply it for you in English. So अगर child काम में help मांगे और खुद ना करे तो क्या करे? काम में हेल्प मांगे अगर चाइल्ड और खुद ना करे तो आप उसको हेल्प करो, बट हेल्प के साथ में चाइल्ड को इन्वॉल्व करो. हेल्प का मतलब ये नहीं है कि आप काम करो. द डिफरेंस नो. एक तो आप बच्चे को हेल्प कर रहे हो और एक आप खुद से काम करके दे रहे हो. सो बच्चे को हेल्प चाहिए. बच्चा डिफिकल्टी लेवल, वो बच्चे को वो टास्क डिफिकल्ट लग रहा है, उसमें वो हेल्प चाह रहा है. आप डिफिकल्टी लेवल को कम कर दो, उस टास्क को इजी कर दो बच्चे के लिए. और प्लस आप हेल्प भी करो, बिकॉज बच्चा आपसे हेल्प मांग रहा है. अगर मैं आपसे हेल्प मांग रहा हूं, आप मुझे हेल्प नहीं कर रहे हो, देन आई विल बी डिमोटिवेटेड. सो अगर वो बच्चा आपसे हेल्प मांग रहा है, आप उसको हेल्प करो. लेकिन हेल्प करने का मतलब काम करके देना नहीं होता है, ये ध्यान में. हेल्प मतलब हेल्प होता है. बच्चे का हाथ पकड़ो, बच्चे से काम कराओ, खुद से करके दिखाओ, फिर बच्चे को इंस्ट्रक्शंस दो, बच्चे को बोलो अभी तुम कर सकते हो, अप्रिशिएट करो। अगर उसने पूरा काम मत देखो, पूरे काम को टास्क एनालिसिस करके उसके छोटे छोटे स्टेप्स देखो, कौन से स्टेप को बच्चा कर पा रहा है, कौन से स्टेप में बच्चे को स्ट्रगल आ रहा है, स्ट्रगल वाला स्टेप आप कर दो और बाकी का स्टेप जो बच्चा कर पा रहा है उसको करने दो। Then you will see the success for sure. So I'm repeating this question in English for my international participants or non-Hindi speaker participants. The question from Pooja is that if the child is asking for help, then what to do? Should I help or should I not help? And my reply is, if the child is asking for help, that's a very good sign that child is connecting with you. You should help. But help. Don't do the task for him. Don't helping into a task and doing the complete task are two different things. So help the child, show it to him how to do it, do the task analysis of that particular task where the child, and try to find out where the struggle is. So make step by step. If there are 10 steps involved in this task, maybe struggle is only 2 steps, but child is asking for help because child is looking at the task as a whole. So you look at the task into 10 steps, let the child do 8 rest steps, 2 steps, wherever they come, you help, you do it, but don't do the whole task. Okay, any other question from anyone? Let's see. I'm seeing the Zoom chat now. Okay, Bhagirathi says, good evening, nicely explained for parents. Thank you, Bhagirathi. Kolal Kishore Kitki. Sir, how to teach an autistic child who is 10 years old her basic living skills in dressing? See, in autism, Samruti, you have raised hand. Let me just finish with this question and then I'll come to you. I just saw it now. I'm sorry. So I'll come to you. So in autism, we don't go with calendar age. You are saying child is 10 years, but at what age child's cognition is, we don't know. So we need to go as per child's cognition developmental age. And you want to teach basic living skills like dressing? Very simple. Again, 5-step formula, task analysis. First, make a list of things that child can do. Then second, task analysis and dressing, what all child needs to do. Unzip, zip, buttons, put the button, open the button, take the clothes out from the cupboard, remove her own clothes, put on other clothes. Now, analyze these steps with things that the child can already do. Child can at least open the door, almirah, and close it, wardrobe. Child can pull the clothes that she wants to wear. She can do it. So start from there. Other tasks you help, but start from what child can do. And then side by side teach different, give child different child exposure of zipping, unzipping. You give bags, purse, clutchers, multiple things you can give to a child which have zip. So open zip, close zip. Put the toys in a bag which has zip. The toys which child likes, and put it in front of the child. Show it to child that I am putting it in, and zip it, and then give it to the child. Child will definitely open it and take it. Even a 2-year-old child will do that. So she will learn. Similarly, create a bag or find a bag which has button, put some chocolates in that bag, give it to the child, but put it in front of the child. So child knows there are chocolates inside. Child will start opening the button. Show it physically how to open the button, close the button. So likewise, you can help it.
Sangeeta, that's the mantra. Virathan? Fine, yeah, only what you have to do, sir? Oh, one is enough.
Yes, Amruti, we can go ahead with you, please. You can unmute and speak.
Hi, Dr. Alok. You can hear me,
Yeah,
right?
hi. Yes, I
So,
can.
so it's not more of a question, it's more of a compliment slash comment. I just wanted to mention that I think whatever you're sharing, because I'm a parent of a 14-year-old boy who's on the spectrum, and we've had our own journey and our own learnings. Even though I'm in California, I need to mention this, that the therapist can only do a certain portion of things, like, once a week or twice a week. It's the parents who have to do it. And I seriously appreciate the effort that you're putting in educating the parents and creating the awareness around. And I mean, as parents, we do a lot, but having this reminders again and again, sort of appreciation for these parents and motivation for the parents is very nice that you're doing, because even though I have been in this journey for 14 years, I still come to your meetings to listen, to reiterate what I can do better, what more can I do for my child. So this is helping me in a way which keeps me on track and keeps me accountable, because that child needs help. And if I am not motivated enough, I cannot help the child. And everything starts with a small step, I agree, and repetition is the key for everything. And uh, I think our kids, they are so non-manipulative, and any tiny appreciation you give, they're really happy, and we as parents are the world to them. So whatever we do, whatever we teach them, whatever we expose them, anything we appreciation, we do we appreciate, they're happy about it. So I think you are doing a great job of initiating these discussions, motivating the parents, and constantly reminding them that you are doing a good job, but there is still more progress to do. There's still more that you can improve yourself so that your child can benefit from it. Thank you so much for that, Dr. Alok.
Thank you, Samruddhi. Thank you very much. And I would request here, if you want to appreciate me, the true appreciation would be just take out some time from your busy schedule, volunteer with us. Even if you can
Absolutely.
speak to parents with 20 minutes, 30 minutes throughout your life. I'm not asking you to do it every day. I know it is difficult, or every week. But let us have a session where you are motivating the parents and sharing your journey, how you could overcome the challenges which you had. That would
Absolutely.
help parents a lot.
Absolutely, Dr. Alok, because I wish I had such a group or such kind of discussions when my child was young. I got to
Mhm.
know or started participating in later stages of his age, but I wish I had such things. And I'm really, I'll be really honored if I can motivate at least one person, one parent, because we as parents of this community need a lot of motivation. It could be because there's so much resistance, there's so much stigma in the society. It's just our parents within our community that can motivate each other. And we're doing a great job. We're just doing a great job, which any neurotypical kid's parents would do. We are doing at least 10 times more than what they are doing. Be it the patience levels, be it the work that they're doing, anything, you name it, we're doing 10 times than a regular parent. So I'm more than happy to give my inputs, my insights, and my learnings if it can even help one parent. I'll do that, Mr. Alok. I'll contact you on a separate
Thank you
note.
so much.
Thank
Thank
you.
you so
Thank you.
much. I sincerely appreciate that. And as rightly said, our journey as parents of special children, when parents come to me and ask me at very initial level, because I am into diagnosis as well. So when it's been diagnosed and parent is in distress, they do not know. Many of the parents they have not even heard about autism spectrum. And they ask me, why us? Why me? I say, this child has come to your life to give you learnings. Your journey is much more about than the other parents. You learn a lot. And that's what you are replicating, that our journey is much more beyond than the parents of neurotypical kids, because we learn patience, we learn development, we learn the true cognition, how to cognition works. And we learn how to motivate our children. And other parents make small mistakes, which we can see. No, they are making mistake. So yes, Smriti, thank you so much. I'll connect with you and we
Sure.
will probably have a discussion on what topic we can talk. And as per your convenient time, as per your availability, we will schedule session. And I'm sure parents would love to join and learn from your experiences.
Sure, Dr. Alok. These timings actually work perfect for me. So you don't have to
Mhm.
make any changes. If I can get just 5 to 10 minutes within that time, also, I'm fine with it.
Sure.
Thank you.
Thank you.
Thank
Thank
you.
you so much. Sylvester, Marcel, can I ask you a question? Sure, Sylvester, you can ask me a question. You can just unmute and speak. That's not a problem. You're there? I can see you. I'm sorry, I can't see your name here. If you are there, you can ask me a question for sure. Because there's a list of participants. I'm not able to see all names. They are on YouTube Live as well. Okay, next question. Meanwhile, I'm taking next question. My 9-year-old daughter prepares tea, chopped tomatoes for vegetables, and help me offer. I appreciate Pragya. I appreciate. This is Pragya Tiwari, a mother who says that she has 9-year-old daughter who is helping in preparing tea, chopping tomatoes, vegetables, help often. I appreciate. See, do not take it as a task. Do not take it that she is helping you. Don't. She is learning. Her therapies are going on in chopping tomatoes. Her fine motors, gross motors, hand and eye coordination, cognition, decisions. She's taking decision to chop this tomato, then I have to chop the other one. This tomato, when I cut, then I have to slit it like this, or like upside down or downside up. All these decisions she is making, that is helping her cognition. So involve her as much as possible, Pragya. Thank you so much and keep doing good work. Has very low hand and leg strength. Kolal Kishore Ketki, I think this is in continuation to your question on dressing skills. It's okay if has low hand and leg strength, no problem. Strength can be built up, muscles, exercises. You can connect with your physiotherapist, occupation therapist, they will guide you, or you can connect with us. Our team is there to help you. So we will give you some activities, some exercises that you can do with your child. But we expect the child to do the activities. We expect the child to do the exercise. We need to have motivation for them. We need to be with them. Remember in the poem today, in the beginning, Chinu was saying, don't walk ahead of me, walk by side of me. So you be along with your child and do the same exercises what your child needs to do. Then you see she will start doing it with you. And the strength, muscles and brain, the brain cognition, these two things, the more you use, the more strengthened they become in our body. So the more you use your muscles, the more strengthened the muscles are. Though with exercises, you get the strength. Same time with exercise of the brain, you get your brain works. So cognition, you give more inputs to the brain, you give more practice to the brain, cognition improves. Pragya says, I'm struggling in academics and communication. What are your charges, sir? Pragya, there are no fixed charges as such. Depends on what is the need and accordingly we plan. We are an NGO, so we are on non-profit basis. We charge you only very nominal amount. So you can connect with us. Let us understand the need first. On a call, you can connect with me. Accordingly, I'll be telling you the charges. There's no fixed charges. If you want to plan for the functional goals, then we will plan together. If you want to plan the whole intervention, the home plans, we can do that. We also have a project, new project, which is starting from day after tomorrow, from 2 days back, 2 days after, I mean, so 1st of April. So 1st of April at 6 p.m. we have kept the orientation of Aspire project. Aspire is a unique project for the first ever time, which is an online schooling program for children with autism, which includes therapies as well. So it is an integration of therapy and academics. We are going to follow the NIOS curriculum. So integration of academics along with therapeutical support together, 9 to 1 are the timings, going to happen on online mode. For more details, you can connect with our team members. They will send you the details. You may visit our website. The Aspire project details are already there on the website. You can see that. And the orientation session is on 1st of April 2026 at 6 p.m. India time. So you can connect in that orientation session. We'll send you the Zoom link. We'll send the Zoom link in the webinar group also. If anybody is interested, you can join that. And there you can find help. And that is again on a very nominal charges we are doing it. Shweta, okay. Shweta, yes, doctor. Aap sahi. Okay, Shweta is writing in Hindi. She is a SEN teacher from Mauritius. Okay, Shweta. So yes, doctor, aap sahi hai. I have got a lazy student. Again, Shweta, I'm sorry. Don't label the children as lazy. They are never lazy. They are never lazy. They may be struggling with something. So I have a lazy student. She does not want to do classwork. Then I do reverse role play. She is the teacher and I'm the student. Okay, she helps me with the classwork then. Wow, this is a good strategy you are using. But the wordings which I really didn't like, that she does not want to do the classwork or she is lazy. But now, when after reading whole, I understood. I understood the real context. So yes, that's a very beautiful strategy. If she does not want to do the homework or she is finding it difficult, you are adding motivation to her, giving her opportunity, giving her confidence. She becomes the teacher and she teaches you. She's helping you in the classroom. I appreciate this, Shweta. That's a very unique strategy you have taught me today. And that's how learning continues forever. It's not a 1 day or 2 day or one project which will finish with deadline. Throughout life, we keep on learning. We learn a lot from these children. I have learned a lot from parents like you. All the parents. I've learned a lot from the teachers, from therapists. So learning continues. So this is a very good strategy. I will also apply it on some children here and get back to you with my feedback, Shweta. Thank you. Poonam Dua, my son, 19-year-old, still does not want to brush teeth and take bath. How to make him understand? See, we need to find out, Mrs. Poonam, whether the struggle is with brushing the teeth or taking bath or about awareness about hygiene. So at 19 years old, I find it would be more about making him aware about hygiene. So just WhatsApp me. I'll send you the steps that you can follow. I think we have connected before for your child personally also. So you can just WhatsApp me. I'll send you the whole document, step-by-step procedures for creating awareness in the teenagers about hygiene. That is important. So you can WhatsApp me and I will send it to you. You can follow those steps that will surely help you out. Okay, here comes Mary. Mary says, hi, sir. In the month of February, we had sports day at school. Okay, where my son was included in a race where he had to carry a basket. Okay, carry and basket of 2 kg of books in a box, take it from one end to other end. He couldn't do it as he has cerebral palsy right side. Okay, hemiplegia. Because of these kind of instances, I feel my son somewhere has taken a step back in doing things that is out of the stride. Happens because of this. If I'm unable to do something, if I find it too difficult, I go into withdrawal and I don't want to repeat it. I don't want to do it. Is there a possibility my son can have a feeling that he cannot do things like he cannot do things like other kids? Yes, there is a possibility. If he's finding if he's struggling to do things like others, there is definitely a possibility that the child has feeling that I cannot do things like other children. At the age of 9 years, it is possible. Do they have that understanding of feeling bad or feeling demotivated? Of course. And they cannot do some things which other children or children of his age can do it without any effort. Even if the other child is neurodiverse, still can do better than him on sports day because they are physically fit. Okay, let me tell you autism. Treat autism children as normal as you and I are. Do not do this differentiation that neurotypical children are doing this and autism child. I have my child who's with autism is not able to do this. By doing this, we are creating barriers and limitations in our own mind, in our own approach. A child with autism can do everything that a neurotypical child can do. I have seen that. They can do everything. Just that we need to provide the supportive environment and see where the struggle is, provide the support in that area. That's the only thing. They
But
don't
sir,
struggle in doing things. They don't, just a moment. So they don't struggle in doing the task, but they struggle in some simple steps. Those steps, you just provide the support. And yes, they have feelings. They understand it very well. They sense the environment, not only looking at others, even your emotions, they can sense. Emotions travel. Your stress, emotions, your anger, your fear, your happiness, they travel in the environment. In a house, if one person is unhappy, automatically others become unhappy. One person is very happy, others also become happy. So emotions, they travel from one person to other. So they can sense those emotions. And they have those feelings, yes, he can do it, I cannot do it, or he cannot do it, I can do it. All these comparisons are there. Yes, please. Somebody was speaking. Sorry.
So I was talking.
Okay. Yeah, Mary.
So this is Mary. Sir, I feel that that sports day that was there, it was typically with all special children only because I go to a special school. So I felt that uh, my son,
Mary,
after that instance,
I'm again
after that
saying
instance,
this. I'm again saying this. Stop using this word special children and neurotypical children. Children are not special. It's parents who are special and our needs are special. So I always consider parents as special parents because you
correct,
need to educate yourself more. You need to work more. You need to grow in your journey. Children are same. Neurotypical children are same like our children. They think alike, they work alike. It's just the brain cognition differences that is there in everyone. In you and I also, there are differences in expressions, in perception. Okay. Yes,
so
please continue. Sorry.
so I want to say, sir, I want to ask, sir, that is there a possibility that he might have felt, emotionally, distress, or he might have felt that, the other
Yes,
children were better than
is there?
him.
Yes, possibility is there.
So can this affect him?
Of course, it affects demotivation. Directly
Correct.
turns into inferiority complex or kind of discouragement. Their confidence
Correct.
level goes down.
Yes.
So we need to
So, sir,
encourage the child. We need to work on the confidence building
yes,
activities, and child will be
correct.
able to cope up. It's not that it's
Oh,
a lifelong thing that has happened. There's a
yes,
damage,
correct.
but damage is a short-term damage. We can overcome it very easily. And at
Correct.
this age, children are very tender. So nothing is
Yes,
forever. Okay.
correct, sir.
So they get excited like this, they get demotivated like this.
Yes.
So within a day, you can overcome this challenge. It's not a big challenge,
Okay, sir.
but possibility is
Thank you.
there. Of course, possibility is there. Okay.
Thank you, sir.
Thank you. Okay, I'm going with the next question, which is there on the screen. Milena Bob says, is it advised to use medication to control unpredictable tantrums, as sometimes he can become a little violent? There are no unpredictable tantrums. Tantrums are behaviors, and behaviors always happen for a reason, and they are always predictable. It's just that we need to understand to learn. We need to understand. So earlier we used to say, I mean, if I go back, say 100 years back, we used to say there was a sudden rain. Yes, suddenly it started raining. Now we know the predictions. We know when it is going to rain, how much it is going to rain. Approximations, we know with the science. We know water evaporates from the sea or from the rivers or from water bodies, goes and mixes up with the other clouds, becomes clouds. Then those clouds, they travel in the direction of the air. And then if there is a hurdle or if there is some the climatical conditions, then it freezes again back into either snow or droplets, and that comes on the earth. So there is a process. Nothing happens in this world suddenly. A small seed growing into a small plant or a tree or fruiting takes time. Nothing happens suddenly. But when you sow a seed and then keep watering it, you don't see anything for 15 days, 20 days, 30 days, Bob. And then suddenly one fine morning you wake up and you see small bud coming out, sprout. Then you see, oh, tree is growing, plant is growing, and you feel happy about it. That has not happened suddenly. Just because it was beyond our eyesight, we could not see it, we feel it is sudden. So yes, I agree with you, Milena, that it could be an unpredictable tantrum for you. But when you read behavior, I'm sure it is not unpredictable tantrum. Medication, I am not in favor of medication. However, in very severe cases, as per the prescription of the medical practitioners, we might have to go with medication. But medications are not the lifetime solution. With the growing body mass, with the growing age, you will have to keep on increasing the medication. How long will you go? and the chemicals, the effect of them in body. And for unpredictable tantrums or hyperactivity or such kind of conditions, usually the medications we give is for slowing down the brain activity. And if you slow down the brain activity, how would child learn the things? Just think of that. So yes, if you need help to understand why these behaviors are happening, I'm saying these are not unpredictable. You are saying unpredictable. So why these behaviors are happening? Behavioral communication. On my YouTube channel, I have this video in two parts, part one and part two. It's open for all. You can go to my YouTube channel, which is @ Dr. Alok Arora, DRALOKARORA, and you can see the behavioral communication videos there. I've taken sessions of 2 to 1.5, total 3 hours session. Whenever you have time, just go. You will understand that by behavior, how child is connecting with you, how child is trying to communicate to you. And you'll start seeing with the ABC analysis, if you start doing of this unpredictable behavior, these behavior will become predictable. You'll be able to predict why these behaviors are happening, when these behaviors are. Okay. Thank you. Shweta, sorry, Dr. G, I forgot I shouldn't have used the word lazy label. I will bear that in mind. Thank you, Shweta. And I did enjoy my role as a student. She helped me to do classwork successful. I'm visualizing it, and you can see the excitement on my face. I mean, I'm very happy with this strategy, and it is something really creative and unique. So appreciate to you. Thank you. Mary says thank you. Shweta says thank you. God bless you. God bless you all. Any more questions are there? Let me just check on YouTube also. There are no more questions. Yes. Okay. Any more questions anyone has? Or we can wind up for the day. Perfect. Let's wind up for the day. See you all once again on Thursday at 8 p.m. with a new topic, new discussion, and new learning from you all. So I'm here to not to teach you, I'm here to learn from you all. Thank you so much. Thank you everyone who participated. Thank you for your time and have a blessed week ahead. Bye-bye.
Thank you, Dr. Alok.
Thank you, sir. Thank you.
Thank you, Dr. G.